Hello, this is Christine, physical therapist and creator of Aging with Ability, where my goal is to provide encouraging resources for older adults to improve their health and age well. Welcome to today's episode of the Aging with Ability podcast. Today's episode falls under the theme of Memory Monday, where we talk about all things aging and cognitive changes, including diagnoses, medication, and healthy living tips. Last week on Memory Monday, we talked about cognition and what's included in that. And today I want to talk about some early signs of dementia, as well as comparing dementia to delirium, which might be a term you're not as familiar with. So first of all, let's start out like we usually do on the podcast with a definition of the term dementia. So according to the Alzheimer's Association, dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. So dementia is a broad term. Alzheimer's is the most common type of dementia. It accounts for between 60 and 80% of cases. So that's why in the general population, we kind of use those terms interchangeably, like someone has Alzheimer's, someone has dementia. It's just not as clear of a term as saying the type of dementia they have necessarily, but we understand, kind of what that means. So some of the early signs of dementia include memory loss, difficulty concentrating, confusion impacting daily tasks, difficulty with conversation or finding the right word, uncertainty about time or place, and mood changes. So this group of symptoms is really wide-ranging, those are kind of broad terms, mood changes, difficulty concentrating. So each person is impacted differently and may have more of one symptom than another, of course. And also the biggest thing is is that impacting their daily activities? Is that impeding their abilities that they used to have? And so dementia is truly damage to the brain cells and how they communicate with each other. So that's why you start to lose those connections, and someone with dementia has a harder time doing the things they used to do because those connections were there, the information got to where it was needed to quickly, and a lot of things were just automatic. But then people with dementia start to have a harder time and have to concentrate harder on tasks that used to be easy, or there are mood changes because of the way the brain is communicating, or frustration about how it's not working as well as it used to. So those are some of the symptoms, and of course there's a ton of information out there. There's different tests, there's different things that can look more deeply into whether or not this is truly dementia. And that kind of leads to my next topic here about comparing acute memory changes to long-term. So dementia is a long-term condition. It's chronic, typically progressive, and has this wide range of symptoms. Whereas this concept delirium that you may or may not be familiar with is a disturbance in mental abilities that results in confused thinking and reduced awareness of the environment. The start of delirium is usually rapid, within hours or a few days, and that's a definition from the Mayo Clinic. So delirium can often be traced to one or more contributing factors, such as a severe or chronic illness, changes in metabolic balance, such as low sodium, a medication, an infection, a surgery, alcohol or drug intoxication or withdrawal. And symptoms of delirium can be similar to dementia, and that's why it's so important for healthcare teams to have input from family members and people that know that patient really well, so we can define whether this is new changes or whether these are things that have been going on for a long time. So I work with patients that have dementia and delirium. And the biggest thing is, especially in acute care, you see more delirium. So that may be someone who has a bladder infection, or especially if someone has an infection that turns into sepsis, far more serious infection, or they're recovering from surgery and maybe the anesthetic led to some delirium symptoms, or there has been a recent change in medication and they're responding with a period of delirium. A heart attack can cause delirium. And then, of course, something even more traumatic like a stroke or another type of brain injury, it can result in some memory loss and behavioral changes. And some of that may recover as the brain heals, and some of it may not. So you are more predisposed to delirium if you already have dementia.
but an event can trigger delirium as well without underlying dementia. So kind of like the Mayo Clinic definition was talking about, where that role of family members or friends or people that know the patient really well is super important for the healthcare team to have that information about their true prior level of function and what cognitive changes are new. So, a quick tip conclusion and kind of bringing that information together in an easy to remember chunk. So, remember that there is a difference between short term and long term memory changes. And if you've noticed some short term changes in mood or behavior or memory issues you're having, you can talk to your family members or friends and see if they've noticed those changes as well. Sometimes those are the people that have insights into whether there's been a pattern of change in our behavior and mood and things like that. And you can also refer to the acronym in one of the links below, and that tells you some of the different causes of delirium like we discussed, and it's kind of a nice little quick reference with that acronym. If you are concerned about memory changes, discuss that with a provider, and they can either give you a short cognitive test in their office or look at your medication record and see if there's anything new that might be causing some symptoms, or refer you for other therapy or resources. I work really closely with occupational therapists in home health and acute care, and they're really great for memory changes that impact your daily activities. And they can give you, homework activities and different things to help preserve that memory, and also strategies if you're starting to forget things, putting notes around your house for different things you have to remember to do, or simple things like that can help you be as independent as possible. The other part of the therapy team that works a lot with cognition are speech therapists. Their title is not really as clear as it could be because they do a lot of different things. And they are really good at helping, especially if your memory is affecting your word finding ability, or they also can give kind of these tests that tell what type of memory you're having an issue with. So as a physical therapist, I'm more on the side of helping with those strategies, but also really encouraging the exercise side of things, because your exercise is so good for your brain health. It releases endorphins, it helps with your cognition, and prevents, harmful changes to your brain as well. So check out the resources below, and we'll see you next time.
Thank you for joining me today, and remember to send any questions you have to Christine@agingwithability.com, or comment on the website page associated with this podcast episode, or on Facebook or other social media resources. Thanks again. Have a good day. Stay healthy.